Morning, ladies and gentlemen, and thank you all for creating time and joining us today for this session. We'd kindly ask all of us to have our microphones on mute, and if you have a question or point of concern, kindly use the raise hand icon on the bottom of your screen. We can also use the Q&A section, and we also have a chat whereby you can share your concerns. But before we start, I'd like to welcome one of us to start us off with a word of prayer so that we can have a blessed engagement. Brother Muteti.
Hello and good morning, Geoffrey. Thank you for this opportunity, and I will also take this opportunity to thank everyone for joining in, and I will pray. Father, we thank you for this moment. Thank you for helping us to have these plans and making us to be committed to it, and for it being a success for today. Father, we want to ask you that you may guide our ideas, guide our thoughts, and also as we send our condolences and we pray for our neighbors, Tanzania. They have lost a very good leader. And Father, dear Lord, we know the people who live a good life dedicated to you, they don't live it in vain. They go to a better place once they leave this flesh. So Father, I believe that President Magufuli has gone to a better place. I want to commit everyone who is joining in today that, Father, even as we meditate upon the death of the President Magufuli, may we learn from his life, and also we may learn from the challenges that he had as a leader, that you may be able to live better lives, whereas people who are going to live longer. We pray that, Father, at the end of this meeting, we shall have had great deliberations and good recommendations that will help us to make our lives better and advocate for better policies in this country. In Jesus' name we do pray. Amen.
Amen. Thank you so much, Brother Joshua, for the word of prayer. So to our program, we'd already listed what we are supposed to do from now on. So I'd like to introduce the organizations and the representative joining us right now in no particular order, and I will start with our panelists for today. So kindly, we'll start. Let me first recognize Kenya Paraplegic Organization, and I can see Wycliffe is on call. Kindly, Wycliffe, can you say hi to us?
Good morning, everyone on this call. My name, as you've heard, is Wycliffe Osango. I work for Kenyan Paraplegic Organization based in Nairobi. Thank you.
Thank you so much, Wycliffe, and welcome on board. Next, I'd like to welcome, I'm trying to locate on the call. Just a moment. Can Brother Joshua, can you introduce one of the panelists?
Hello, Tim.
Hello.
My name is Wanja Wangondo of Kenya Revenue Authority, and I'm happy to be here. Thank you.
Thank you so much, Wanja, and welcome.
Thank you.
We are having our consultants from Caro, are you on call?
Mr. Koech,
Can you hear
Yes,
me?
I can hear you, Irene.
Madam Caro is asking for around 5 minutes. She's trying to join in. Same to Elsie from KPO, who's going to be represented by Wycliffe, because Elsie is also having a bit of a challenge. Thank you.
As we are waiting for them to join in, I think we can go to the next part of our program, whereby I'll allow Madam Irene Otieno, our national coordinator, to give her opening remarks.
Thanks, Mr. Koech. I'll kindly request that I'm seeing Mr. Boniface, who's also from Development Initiative, past of the panelists, is on the call. So maybe he can introduce himself, then I move on to speak kindly.
Good morning. My name is Boniface Owino, working for Development Initiatives from here in Nairobi. Thank you.
Thank you so much, Mr. Boniface, and welcome.
I'll go straight to it, Mr. Koech, if you allow. I hope my light is okay. Our IT person can support me just in case you cannot see me well. I thought it's good also to just put a face to it. So give me a minute for him to just confirm for me on the lighting and everything. Thanks. I've been guided that all is well. So many thanks first for all of our guests that have made time to be with us. As has been stated by my team member, Mr. Koech, our National Taxpayers Association is a not-for-profit organization that has been greatly concerned that Kenyans pay taxes. I think this is a concern for all of us. But in terms of service delivery, there have been a bit of a concerns from the public. And we feel that these concerns, if not addressed, would have a negative impact on domestic resource mobilization. And we have seen the Revenue Authority, who are ably represented by Madam Wanja, alluding to the fact that the revenues have been dipping, we have not reached our full potential of raising resources. But if you ask this question to the taxpayers themselves, they feel like they're not getting value for money. So we as an institution, we view ourselves as an entity that would be able to have this type of discourse that would be able to bring both the revenue administrators and the government side with the citizens who pay the taxes, for them to better understand which constraints both of them have and how we can better address some of those concerns. So more specifically for today's engagement, with the support of Voice. Voice is a funder that draws from Oxfam, from Hewlett Foundation, and the Ministry of Foreign Affairs of Netherlands have put together a bit of resources that would bring the voice of the vulnerable groups. So we have people living with disabilities, we have women who are suffering exploitation, and youth to be able to raise their concerns, to participate more on governance, and more specifically to have their voices heard on matters of taxation. So we undertook a political economy analysis just to understand what are the issues. And so the respondents were the ones that I have highlighted. So there was a report that was developed, and the purpose of today's meeting is to have these specific respondents or groups, these groups seeing what is connected. Sorry? Oh. Let me continue. So for these groups to critique this document, see if there's anything we missed that the group thinks is relevant for conversing with the Revenue Authority and the government, and then also give us input on how we move the project further, because we have an opening to continue with this project for 1.5 years. The initial part was just to collect data that would help us program. So here we want to hear the concerns. What do we need to address in phase 2 of this project for all of us to see value out of it? So in a nutshell, I've really explained what NTA is all about for the purposes of persons who are joining us for the first time. I've also tried to explain the real context and purpose why we are here. And so as I come to the close of this, because I know we also have limited time, is to thank the Revenue Authority for taking time to be with us. I was reading a note from my colleague here. So just to thank the Revenue Authority, this is our very first for us. We've been working as an association majorly with the citizens, but we felt it's also important to work closely with the Revenue Authority first because of the amount of data they have that can help us even in research and understanding the issues. We felt it's also important because as we do our community work, a lot of people have asked, how can you discuss matters tax without having the main tax administrators in the room? So I would like to extend my appreciation to the Director General at KRA, but more specifically for the Commissioner Domestic Tax for having agreed to this engagement and giving us a representative. I also would like to recognize the exemplary work that is undertaken by development initiatives, represented here by Mr. Boniface. Very good data on safety nets and how do we ensure there's equality and issues around that, which Boniface will speak to better than I can. I know our friends KPO, Kenya Parapletic Organization, is also here with us. They specifically program around people living with disabilities and how to make their lives much better. So we appreciate them taking time to be with us. I know the NCPWD, the Council for People Living with Disabilities, is also with us. My colleague Joshua will confirm whether their representative has also joined. But we felt that in terms of the report that we received, a lot of issues were things that can really be addressed better by the council. So we are also happy that they committed to be with us today. So I would wish us, I want to leave it there and wish us very fruitful deliberations. I'm interested in people being very open and giving us what their challenges are so that as we move to the implementation phase of this project, we are implementing a project that can make a difference in the lives of the taxpayers in Kenya, because that is what we stand for as an institution. So asanteni sana na tuzidi kuzungumza. Thank you.
Thank you so much.
Asante.
Thank you so much, Madam Irene, for the introduction. As per our program, we had a little change whereby we decided that we'll show the clips just before the meeting starts, which we did. So I'd like to confirm we had our analyst had a small problem joining in. So I just want to confirm whether Caro is with us so that she can take us through the analysis of the. Joshua, can we confirm the presence of Caro?
Hello, Koech. I think our analyst will be represented by Victor Mose, who is already on the panel, so he can go ahead.
Okay, thank you so much. Mr. Victor, welcome and proceed.
Thank you, moderator. Maybe you can confirm if you can see my screen.
Yeah, I can see your screen.
So thank you for the opportunity. My name is Victor Mose. I'm going to make this presentation on behalf of Dr. Onsomo, who could not be with us now for due to unavoidable circumstances. My colleague Carol will be joining us in the process. So this is the Royal Nexus who did the survey on the political economy analysis in Nairobi and Kisumu counties on the implementation of AGPO and the GAF, and also on the role of inclusive taxation for the persons with disabilities. Having followed the conversation and the objective of what we are doing today here, I think I wanted to state right from the onset that inclusive taxation will encompass quite a number of issues. Inclusive taxation will include, yes, paying or meeting our obligations as a taxpayer, but also getting value for money as a taxpayer. So the inclusivity will therefore require that taxation should be able to reach various groups who have interest, and also government is also trying to reach out for purposes of inclusion. So we are going to make this a presentation, and along the way we'll discuss some of the issues and emerging issues as they come. So for those who may not be aware of the sign you have just seen, that is a sign for welcome. That is a sign language for welcome. In my presentation, if you moderator, you're able to see the third slide, because from now I'll be moving very fast.
Yeah, I can see from my end.
You can see from your end as I'm moving. Thank you very much.
Yes.
So my presentation is the elements of introduction, as the outline. We also have some legislation and reforms, data sources, methods, results, and the conclusion, as well as policy recommendations as I've noted. So when we're analyzing a political economy, this was conducted in December 2020 in Nairobi and Kisumu to understand the socioeconomic and the political factors that influence success or failure of the rights of holders of groups, access to productive resources. And as I've noticed, as I noted, we are talking about inclusive taxation, for instance. So policy objectives addressing challenges that persist in inclusion of special interest groups in the socio-economic and political and the decision-making processes. That was the policy objective. We wanted to address all those challenges of inclusion, such that the special interest groups are able to see themselves as part and parcel of the inclusive taxation. Now, the specific objectives of this work was to
You've mute yourself. Kindly unmute.
Okay. Hello.
Oh, sorry for that. Sorry for that. I think so. We were to develop a checklist of allies to strengthen advocacy. Sorry, once again, I was trying to take care of some noise coming from outside. So we needed to identify the key issues in the implementation context of some of the legal framework which we have, map the actors who will be able to help in the process of inclusion taxation, and also share some of the lessons we are learning from critical committees at the county level. So in terms of legislation and the reforms, we noticed that there are many other policies there, but we have highlighted maybe the United Nations Convention of Rights of Persons with Disabilities, which is at a global level. That's the umbrella convention, which tries to bring all of us together globally. We also have the protocol to African Charter of Human Rights. We also have the African protocol for persons with a disability. So we also have the East African Community Policy on persons with disability, because that's the focus we want to have the discussion today is on the persons with disability as a special interest group. And also, government has also played a critical role in initiating affirmative action plans, initiatives such as tax reliefs, AGUPO, that's access to government procurement opportunities, and also national government affirmative action fund to ensure that opportunities are formulated and availed to the special interest groups, persons with disability included. So in terms of data source and methodology, the data was undertaken data collection was undertaken in Kisumu and Nairobi, and we had the questionnaires where individuals were responding to, who are youth, women, persons with disability. We also had a key informant interview for the stakeholders in the county government and also national government, as well as the CSOs, that they're civil society organizations. We also had a focus group discussions which brought together various players in the political economy, including women, youth, government officials, the civil society organizations, and to have a discussion on these issues of inclusive taxation, right from paying tax up to receiving service and so on. So we use the political economy analysis approach for us to be able to get insights. So the study shows that we had around 56% of the persons with disabilities was caused by accident, 31% for natural birth, while in Kisumu, 19% disabilities was caused by accidents, but 25% caused through illness. So in Kisumu, for example, we realized that the persons with the disabilities were aware of AGUPO. We are going to see the statistics as we move on, and the ownership of the AGUPO. Ownership of the AGUPO certificate was low actually in both sides, and with 25% of persons interviewed in Nairobi possessing the certificate. The study also revealed that participation in the GAF was very low. However, the registration to groups was also high. So persons with disability, they have tried to put themselves together in groups, but is the element, the overall statement we are coming out from here is that is access to service, which is still low. So the other element which we have is that the study revealed that that we have challenges with employment, and a number of persons with disabilities are engaging in sole proprietorship and so on. So public participation in budget making process, which should be actually an entry point for policy and planning, you realize it was also very low, if not non-existent, to quite a high percentage of persons with disability in Nairobi among the people who were interviewed. In Kisumu, where we had 4 focus group discussions spread across the country, the county representing the 4 corners of the campus, the compass, it was found out that most of persons with disability have no information actually on government funds and also the acts, the laws and regulations and so on. So the person with disability also help in the who held disability card. This is the card which is issued by the National Council, confirmed that they were normally exempted from tax payment. There are those who could confirm that they are aware and they have been exempted. So government has played also critical role in initiating affirmative action, actually, as we indicated, and we are going to see what are the key issues in access to these services. Yeah, so we have noticed that a tax relief with the just a moment. I think there is somebody whose mic is on. Sorry.
We can proceed.
So you're still seeing my slide 11?
Yeah, we are
So
together.
I was saying the tax relief measures are meant to increase the disposable income actually. So we wanted to note what is key in tax relief, for instance, is that if a person with disability is given a tax relief, you are increasing amount of money available for that person with disability to be able to access or to meet his or her living standard needs. So be it maybe paying rent or getting water or paying for food or going for health services and so on. So tax relief for persons with disability who may be working or who may be doing business is very, 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 very critical, because persons with disability have been left behind for long. And once they get opportunities, actually they need to be supported or given an enabling environment for purposes of also fast tracking their lives moving on. So according to the study, also caregivers are very, very critical to caregivers to the persons with disability. And therefore they also need to be taken care of. You might find that given the severity of disability, it is actually you need to support the caregiver so that that person is also be able to be mentally and economically empowered to be able to give the required care which is required for persons with disability. So yeah, so according to the study, caregivers in Kisumu were not aware of the tax relief. That's through about 9% of the persons with disability were aware of the tax relief. So you can see a bigger percentage are not aware. Nairobi, 50% of the caregivers and persons were also not aware of the tax reliefs. The study shows that the main reason for low uptake of tax reliefs is the challenge in getting the exemption certificate. That is very, very, very key. So this one by extension is also, there's also issue of awareness with the process of getting the exemption certificate. And to increase mobility and communication of persons with disability, we require assistive devices, remember. So, and some of these are actual tax exempt, but now you need to get a certificate to show that you're able to buy these devices, taking advantage of or being enabled through tax reliefs and so on. So assistive devices are used by persons with disability who are either donated or purchased, and therefore that means we need to look at the entire network of access to assistive devices. Yes, as you are giving to individuals, but also the organizations which give these assistive devices. And therefore there is a way maybe Kenya Revenue Authority can restructure its policy such that institutions like the CSOs, civil society organizations, which give these donations or purchase, they are given those exemptions in a special way, because that will be able to reduce the cost and therefore increase coverage in assistive devices. And they cut across the various forms of disability. They could be hearing aid, they could be clutches, it could be the various types of assistive devices based on the forms of disability. It could be maybe what our brothers and sisters with albinism also use, and so maybe the sunglasses and so on. So the other element we want to discuss is that on the persons with a disability is that the study found that the policies which have been formulated guarantee equal opportunities for persons with disability, and they prohibit discrimination of any person. Nairobi Caregivers Persons with Disability were applied for women also empowerment. Yeah, because this is the entire inclusivity we are talking about. The opportunities that were commonly applied for by the women was community work and also business in Nairobi, and so on. So it was established that persons with disability are yet to adequately secure employment, and also they have their supported at the workplace with the various like assistive devices and so on. And the institutions may not be aware of maybe the exemptions which they can get if they were to buy these assistive devices, and even in creating an enabling environment by making buildings accessible and many other things which they do, making the corridors maybe accessible as well, and so many other things. So this is a graph showing the levels of uptake of AGPO and the GAF. As you can see on the graph in Nairobi and the Kisumu, what we have put here in bold, you can see that among the youth, women, and persons with disability, those who are aware, at least a percentage of the person with disability among the people we interviewed, 38% were aware of the existence of AGPO and NGAF. But when you go to the other side of AGPO member, who may have, who has a certificate, you find that those ones who have certificates are lower. So there's awareness, but access to the certificate is low. So when you come to actually persons with a disability, I mean, the caregivers, they are aware, but zero have a member because maybe because they cannot have, because they're not persons with disability. That makes sense. But in Kisumu, you could see also it's a similar picture. That 40%, however, 40%, yes, they say they are aware of the existence of AGPO and NGAF, but zero of them had members. And remember, in some of these discussions which we had, we were looking for, especially society or opinion shapers in the society. If you find such a person who is reliable in the society, in the community, is a person with disability and is not aware or is not a member, that means the trickle-down effect is that even those other people who may not have opinion or who may not be seen as representative of the rest are still in suffering. So the other element we were looking at is how people finance their businesses. And as you can see, persons with the disabilities, 56% do business from their own personal funds.
Oh,
yeah, from their own funds. That means the support mechanism needs to be enhanced. When we look at the percentage of people getting tax relief, actually you could see that the caregivers, yeah, if moderator can request maybe those who have muted to unmuted to mute, please.
Yes, proceed. We're working on that.
Okay. Thank you very much. So on the issue of respondents who are aware of the tax that I was talking about, the tax relief is 29% in Kisumu, persons with disabilities were aware, but 50% were aware in Nairobi. Over 92% of the persons with disability are not accessed actually the tax itself. They're not accessed the tax itself. That's a huge percentage that the tax relief, especially from their incomes, especially from their incomes. And we could also see the various with those who had difficulties with the getting the exemption certificate. Actually, you could find that almost over half of the person with disability, or even the caregivers trying to support the others, were also having challenges in accessing that. So we also had a question which was looking at yeah, the devices that the accessing these devices has its own challenges, reporting 2% of persons with disability, because some of the devices, the assistive devices, are not accessible in the market and so on. So the other element which we looked at was on the gaps which exist now especially in the participation of special interest groups in the various government programs. So you could find that, yes, employment, as you have seen, is very low, but there are actually bottlenecks, including lengthy procedures, needs to be addressed. There is a lack of sufficient and extensive sensitization. That's the bottom line. The programs are there, the policies are there, but now they reach out. The outreach is very, very, very low, especially to the persons with the disabilities. So we also need to, we have seen that low uptake of tax reliefs. There's also low levels of education relative to other groups of people. There's existence of socio-cultural beliefs which actually tend to discriminate persons with a disability, and also women and youth, and participation is very, very low in various government or initiatives. So the low technical skills among the special interest groups, including persons with disability, actually hinder their enhancement of their businesses, for example, when they are doing self-employment and so on. And then bottom line also is the public participation challenges. You realize that persons with the disabilities, they need to voice their needs and rights in various public participation forums, but they have challenges with the facilitation. They have challenges with the location where they're supposed to travel long distance to access the location, but even the location itself, you find that it is not enabling. It is not enabling an environment where the meetings are being held. They are not also given fair chance. They can come, they just attend, they don't participate because they're not given fair chance to participate in such. So communication-wise, we need to have various communication channels, because different forms of disability will require different forms of communication. And issues of transport, communication infrastructure is very key for purposes of ensuring that they are able to attend the various forums. And then the uptake of their submission was very key. Some of the persons with disabilities who had attended, they say that we go for public participation, we say what we require, but rarely are those needs taken into consideration. So this actually now kills the morale because of the bad attitude, and their interest along the way for public participation starts waning. So in terms of legal gaps, we realize that the two-thirds gender has not been met. Economic social rights bill is still pending at the Senate. So legislation of affirmative action programs and policies designed to special interest groups has not been well legislated, such that even affirmative action is more actionable without people saying now, oh, how do we implement this affirmative action? Could we be violating any other existing law? So there's quite a number of issues which need to be fine-tuned. The implementation of the 5% representation of persons with disability in public elective, appointed bodies, even in employment, that is yet to be implemented in the counties which we went to. And even though the constitution has been passed, the implementation of in its entirety has still various challenges, among other legal or policy gaps. Now, by way of therefore recommendations, we have quite a number of recommendations that we are saying that there is need actually to increase civic education targeting persons with disabilities. The National Government Affirmative Action Fund and the access to government procurement opportunities should provide adequate civic education, such that people are aware of processes and any requirement and so on. We should also mount awareness campaigns for persons with disability on issues of tax reliefs and exemptions. Some of them you could see they were not aware. There's need for intensified lobbying with the policymakers within the national and also county governments. And this is an area where the CSOs are playing a very, very critical role, because they are happening, they're becoming the links between the persons with the disabilities or the special interest groups and policymakers, and in resource mobilization and also in facilitation. And these are very critical element which comes along. So facilitation of the special interest groups to public participation forum, it is very, very important as we move on. With this, so even in the development submission of memorandum, they need to be trained on how to develop a memorandum when there's a public participation exercise that they're able to submit and also make oral presentation. Proper communication is required, appropriate location, transportation, uptake of recommendations should be able to be seen, and also the conduct for fair distribution of chances. When persons with disabilities have been invited, the moderators or the organizers must ensure that they have asked at least 1 or 2, 3 persons with disabilities who are present to have their rights and needs articulated. So as a result of that, now you can see going forward, we need to enhance the outreach, we enhance the advocacy, we enhance the informative action. We also encourage formation of self-help groups, not only formation, but even in their participation in the various activities. And also we public awareness and also training of government, the special interest groups on government services. The state and non-state actors create awareness, as I think I've said that before. We should provide funding. You know, we are in a process of mainstreaming. We should provide some funding for these essential services, like that we empower the person with disability. Now, the issues of provide access to legislative forums to air their voices, it can also be re-emphasized more. The proposed suggestion on the cards include consolidation into one card that will enable us, especially the Huduma number. If that can be enhanced, like that persons with disability who have just the Huduma number, all their needs have been captured, and therefore just the one card you will require for purposes of accessing service. So enough time should be given for people to read through budget documents. That also came out from our findings, that budget documents should not be seen the day when the public participation is done. Even when they are implemented in their websites, they should be avail hard copies, but also try to present them in a way that it is easier for persons with disability, women and youth, and also to read. So proper management of funds is very critical. What is discussed should be put into consideration. I've said that budget documents should be presented in a non-technical language, yeah, such that we enhance understanding of the government policies and the direction of plans. Awareness creation of the provision, the training and education must be within the public participation or under processes. Awareness should be budgeted for, that we are going to create awareness among persons with disabilities, and those activities should be funded going forward, such that even the government institutions are able to reach out. Provision of caregivers. Caregivers are good as the persons with disabilities, because if you are not infected, you are affected, if in one way or another. Therefore, they should also find a way to exempt even caregivers of those people with the severe disability. If there are any opportunities, the special interest groups, women, youth, persons with disability should be given priority. because we are mainstream and we are fast tracking because they've been left behind for long. So there should be formation of groups at mashinani, that's sub-national level, and that is the language which the people speak on the ground. Bring services to mashinani. The people want to be felt in the village. Government institutions in Nairobi, in Kisumu, and so on, in the county governments, at the headquarters, they should be felt in the village through maybe the ward administrators and so on. That linkages should be able to be enhanced. Actors, so we should also strengthen advocacy. Advocacy voice is very, very critical. The disabled persons of organizations, the civil society organizations should enhance now their advocacy. They should be heard. They should look for ways to increase their footprints in the advocacy such that these issues are brought on board. And also establish, critical also is to establish working relationships. For those institutions which we were working with here, for example, the NTA and even the presenters from NTA has even indicated that they have been working in close relations with, for example, Kenya Revenue Authority, the National Council for Persons with Disability, and even the NGO, within the NGO world. Establish working relationships with the executive, judiciary, and also the legislation arms of critical, because this is where policies are made, and this is where plans are made, this is where money is allocated, this is where budgets are allocated, and those links will keep on, will help in terms of executing these mandates. So with those very remarks, I think I want to stop here, and thank you for listening and for the opportunity you gave us to analyze this situation. And over back to the moderator. And for those who are not aware, that sign is the sign of saying thank you. You put your hand next to your mouth, then you slide it forward. As you lower it, you say thank you. Thank you very much.
Thank you so much for the presentation and for the lesson on the sign language. I was trying actually on my end while you were giving us the instructions. Thank you so much. Just give like, let's say 5 to 10 minutes for reactions on the presentation. And there were some hands that were raised. So if anyone has a reaction or a question or a comment to what we do, kindly, this is the opportunity to ask, and you welcome. There was a hand up raised by, was it May? Okay, Mary. Mary, do you still have a question or a concern? I can let Florence, I can see your hand up. And then we'll have Sandra.
Hello, Tim. Thank you. This is Wanja from Kenya Revenue Authority. Wow, the statistics are an eye-opener. And I am so surprised to find that people are not taking the tax reliefs that they ought to be taking. And I'm glad to be in this meeting so that we may see the way forward. I've also learned that many people are not aware of the process, and also others feel it's quite long. So I think it's the high time then we get to see how do we make life easy for these persons living with disability. Thank you.
Thank you so much, Sandra. I'll go to Sandra.
Thank you. Can you hear me?
Yeah, I can hear you loud and clear.
Okay, great. So I'm Sandra Morania from White Ribbon Alliance. Thank you so much for your very insightful presentation. It's always very relieving to see presentations around disability advocacy, because that is an area that is completely under invested in. And so I come here asking, regarding the tax relief. I know that I work with women and girls, rather we work with women and girls with disabilities our focus is their voice and their access to quality healthcare services. But when we talk to them, the biggest thing that comes out is access to disability cards. And I saw that show up in your presentation. But more importantly, even as we're talking about tax relief, I imagine before we even have access to this, even the certificate that is already a problem to access, before that, someone has to be first recognized as a person living with a disability. And later on, even the severity of the disability needs to be established. What has come out so far is that process is very strenuous. And from conversations with the community, and I say community, I mean people living with disabilities, the women and the girls, what they mentioned is not just the women, even the leadership on the ground, they said there's a backlog. There's a backlog between the National Council for People Living with Disability and the counties. So you have members who have gone and registered for disability cards a year in, and they do not have their disability card. And even those members who have registered, let's even acknowledge that it's not all of them. And so my question is, from all of this process and from the conversations that you had, the focus group discussions and all the listening exercises, what came out? What was the key insight around access to these cards? Any recommendations on how to clear that backlog? And even for advocates like ourselves, how do we come and help? Because we realize, it's very clear where the backlog is. It's very clear where we can come and intervene. Thank you.
Thank you so much, Sandra. And the next question, I'll pick it up from Evelyn Amunga. I've seen you raised your hand. Evelyn, are you there?
Hello.
Hello.
Okay, I'm Evelyn Amunga. I come from this organization, Young Women Empowerment Program. I'm really grateful for this opportunity to raise up disability matters and share ideas on how we can improve it. I have an issue with the AGPO and the distribution of tenders and stuff like that. We find that when we have these opportunities, it's not clear how it can be distributed among people with disabilities. My recommendation would be to have a project or something to do with inclusion and inclusivity of people with disability as matters of giving tenders or those public procurement opportunities to people with disabilities, so that we can have them on database and then distribute them fairly among people with disabilities, because we find that some people with disabilities have more opportunities and are more accessible than others, which means that those who are marginalized, though all of us have disabilities, but you have some of us who are better off and they are in a position to access those opportunities. Unlike others, in my position, they cannot access, they cannot access them, and you find some people in the community use them to benefit. Somebody can come and tell you that you have a company, you registered, let me do business using your card. It's something that's happening on the ground. So I'd request if you can have something to that. Thank you so much for your time.
Thank you so much, Evelyn. We've gotten your question, and we're going to respond on that. So hopefully I've not locked out anyone. I hope our analysts have taken down. Yes.
Right.
Yeah. Yes, Wycliffe.
My hand was up. I think you've not seen it. Now, I want to thank the presenters for the well done job. They've covered better part of UNRSPD articles. That is Article 19 on living independent and being inclusive, including the community. Article 20 on personal mobility. Article 27 on work and employment. Article 6 on women and women with disabilities. There is they have a concern related to segregating of data. That's in terms of gender, diversity, gender, age, and disability. And on disability, quite if you remember in our last meeting with our donor, there was an issue of bringing up the disability, what type of impairment are accessing the NGAF funds. Are they persons with the visual impairment, persons with the physical impairment, persons with the hearing impairment? Which kind of impairment is accessing NGAF funds more than the others? And what are the barriers that are affecting or that are hindering these other categories of impairments from accessing the NGAF facilities? The other thing that maybe it was highlighted, but I didn't get it, is what are the challenges when it comes to accessing tax-free services from KRA? Of course, one that was mentioned was a registration of to National Council of Persons with Disabilities. So there are other, I guess there are other challenges that could have come out from the study, and if they are highlighted, I'll appreciate. Thank you.
Thank you so much, Wycliffe. So we'll go straight to the next part of our program, whereby we were going to have reactions from
Could I speak, please?
Oh, I'm sorry, I didn't see.
Could I ask a question?
Please proceed.
Hello?
Yeah, you can ask. You can ask. Please proceed.
Yes, this Rockefeller. Hello?
Yes, yes, please proceed.
I'm Rockefeller Keo from Homa Bay.
Yes.
Now, I have a number of concerns. First of all, when it comes to the acquisition of the card for persons with disability, it is a process, it's a long process that needs to be looked into. It discourages, it is disgusting to say the least. So it is a process that should be made easier and simplified for persons with disability to access these services. I have a company, a limited company that deals with supply and construction. And we have been, or have been trying to access these funds meant for our businesses to no avail. They are not there. They are just in papers, but in reality, these funds cannot be accessed. So I don't know how they can be made accessible to persons with disabilities so that we can do businesses with them. Another thing is after acquiring a tax exemption certificate, I don't know why this should be taken in rounds, you know, renewing this exemption. For example, myself, I'm a person with permanent disability. There's no day that I'll get a miracle and get my 2 feet again and walk normally. Then why should I be renewing my exemption certificate? It beats logics. Such like things should be done away with. And then the process of renewing this certificate is very cumbersome. So I'll request the persons concerned to look into this and to make it quite easy for people with disability. Another thing, even in the importation of duty-free, you know, cars, there's just too much paperwork involved, and people are taken in rounds for no apparent reason. If this thing is really to help us, and it is for persons with disability, why shouldn't it be made possible and easy and accessible for persons with disability? Why too much paperwork? Why the hindrances? Why the obstacles? So my take is that if there are some opportunities that are meant to empower persons with disabilities, then let them be made, you know, accessible. Let them be made easier for persons with disabilities to access them. Otherwise, thank you very much.
Thank you so much, Mr. Rockefeller, and I'm very happy about the kind of issues you've raised, and we are privileged today to have a very rich panel, and I think some of the questions will be sufficiently addressed. So on to our panelists, I would like to just have a round of introduction. We have the DI senior analyst, Mr. Boniface Owino. He had already introduced himself. We have a representative. We were lucky to have two. Ms. Wanja has already introduced herself, and we'll give room for Mr. Joash Omolo to do the introduction and take it up on behalf of KRA. We have Kenya Paraplegic Organization. I hope Madam Elsie is around. And we have Ms. Nafula, Ms. Susan, National Council of Communities. Take it up on behalf. I'm sorry about that. Kindly let's have our microphones on mute. So on to the next. I do welcome Mr. Boniface Owino. We have, let's take, let it be brief, at least 10 minutes. Boniface, karibu sana.
Thanks, Geoffrey. I'll go straight to it, and I'll be talking on social protection. So maybe just to start, I would like to mention that the social protection sector in Kenya is quite broad, and it might be a bit difficult to cover the whole of it in just 10 minutes. So I'll just be focusing on a few areas that are relevant for disability inclusion. So as a country, the overall goal of social protection is to ensure that all Kenyans live in dignity and they're able to exploit their human capacities to further their own social and economic development. And the national government has been working towards the achievement of that goal and significant progress already has been made just to establish various programs and to implement them to provide income supports to persons with disabilities and other vulnerable groups. So under social protection, we've got disability specific and mainstream schemes. Under social protection, we have a number of disability specific and mainstream schemes, including tax financed and contributory programs. So under the mainstream tax finance schemes, we've got programs that you already know very well, including the Older Persons Cash Transfer Program. We've got the cash transfers for orphans and the vulnerable children, the Hunger Safety Net Program. And for the disability-specific tax finance scheme, we've got the Persons with Severe Disabilities Cash Transfer Program. And I'll go a little bit into details into that. So this particular program provides support to poor households with a member living with profound disability. That includes people who require permanent or 24-hour care, including support for activities such as feeding, washing, and the protection from danger. So based on the data from the National Single Registry, we've got about 51,000 households currently enrolled in the program. And then again, based on the analysis that we've been doing here at DI, one of the things we've noticed is that the national government has been pumping a lot of money into these, social protection programs. Like for instance, the Persons with Severe Disabilities Cash Transfer Program has received about 6 billion Kenya shillings between the fiscal year 2016-2017 and 2020-2021. So that is quite significant. Despite that important progress, we still have a long way to go as a country in order to establish the kind of a social protection system that will be able to provide support to all those who need it, especially the persons with disabilities. So there are quite a number of challenges which still needs to be addressed, but I'll just highlight a few of them. One of the key challenges we are facing is limited availability of quality data for planning and budgeting purposes. So from the 2019 census data, we know that about the disability prevalence rate is about 2.2%, meaning that we have about 0.9 million Kenyans living with some form of disability. However, from that data, we are not really able to tell the proportion of that 0.9 million people that have severe disabilities and therefore falls under the group that would ordinarily qualify for the persons with severe disability cash transfer program, for instance. So while we know that already 50,000 households have been enrolled, an important question that we need to be asking ourselves is how many other households out there, how many other households are still out there that have not yet been reached but have a member with severe disability? Where do those households live? What are their specific needs? What are the services they're really receiving at the moment? So unless we're able to answer those questions effectively, budgeting and planning for social protection programs for persons with disability will remain a significant challenge. And for the public and the civil society organizations, again, holding the government to account becomes very difficult if we cannot access quality data, because without data, it means doing evidence-based advocacy is a huge challenge. So as we move toward establishing a more robust social protection system, data is one area that really needs to be strengthened. The other important thing that I want to talk about is the underinvestment in social protection programs. And I'll just use the persons with severe disability cash transfer program as an example. So if you look at the budgetary allocation data at the national level, the share of the persons with severe disability cash transfer program has been in the budget for the State Department for Social Protection has been reducing over the last 5 years from 5.2% in 2016-2017 down to 3.6% in 2020-2021. And also even as a share of the GDP, the share of that cash transfer program in GDP has been reducing also from 0.016% in 2016-2017 down to 0.01% in 2020-2021. But an important aspect of that is that the annual budgetary allocation to the persons with severe disability cash transfer program has been fairly constant at around 1.2 billion over the last 5 years. So when the budget is constant, there are quite a number of challenges that are likely to be faced, because it becomes very difficult to increase the number of beneficiaries if you are a ministry and you keep getting the same amount of allocations every year. And indeed, if you look at the Social Protection, Culture and Recreation Sector Report published in 2020, the target number of beneficiaries for the persons with severe disability cash transfer program has always been 47,000 since 2017-2018. And that is in part due to the limited allocation of funding. And even though the figure has been constant at around 47,000, still the number of households that are being reached is less than that. An example will be the 2019-2020 fiscal year, whereby the target was 47,000, but then just about 37,104 households were reached. And there are quite a number of challenges that the government is facing that is preventing them from scaling up that program to reach all the targeted households. But logically, even if the number of beneficiaries remain constant at 47,000, one would expect the budget to be adjusted, at least to take in, to account for things like inflation rate, which are changing from almost every year. So if we keep providing a constant figure of, let's say, 2,000 Kenya shillings to households, then it means today they are worse off than they were 5 years ago due to inflation. And the other area that I would like to talk about is the value of the cash transfer that households receive from the government, which tends to be quite low compared to the average monthly household expenditure. Now, if you look at the 2015-2016 Kenya Integrated Household Budget Survey, what is coming out is that the average monthly expenditure, adult equivalent, is about 7,811 Kenya shillings. That means that a cash transfer amount of about 2,000 Kenya shillings is way below the average monthly consumption of a typical household. So an important question for the government and even KRA is how, therefore, do we raise additional resources so that we can be able to raise the value of the cash transfers we provide to households with persons with disabilities to ensure that they're not left behind. And I think this should be my second last issue that I want to talk about is in most cases, the cash transfers are targeted at households rather than individuals. And the implication of that is that it may limit the choice and control that persons with disabilities have over those cash assistance or transfers. So within those households, the persons with disabilities might not be the decision makers. And that might, to an extent, affect how they're benefiting for those, cash transfers. Another issue that's related to that is how do we make the cash transfers more responsive to the diverse needs of households? Because some households may have 10 members, others might have 2, others may have 5. And even within those households, the type of disabilities that are there do vary. So some households may face higher costs because of the severity of the disability among their members. But if you are providing a uniform figure of about 2,000 Kenya shillings to every household, then it means some households will be worse off. So how then do we adapt these cash transfer programs to take into account the specific needs of various households that are being targeted? Those are some of the issues that we need to address as a country as we move towards developing a social protection system that will be able to ensure that we are all moving together and that persons with disabilities are not left behind as we try to, get to a level whereby poverty is being eradicated. So because of time, I'll leave it at that for now.
Thank you so much, Mr. Boniface, for that eye-opener. There are a lot of things that you really pointed them out, and it will be great if we can collectively pick them up with our duty bearers. I can see there is a hand up by Wilson Kingola. I'm sorry, I won't take the questions right now until after all our speakers have shared. So I'll welcome Mr. Joash Omolo. Kindly, the chance is yours, and if you can turn on your video so that you can put a face on the voice, we'll really appreciate. Meanwhile, before Mr. Omolo takes up, I would like to urge us to share our email addresses via the chat, email address and your name, so that we can share the presentations with you. Thank you so much. Welcome, Mr. Omolo.
Thank you, host. My name is Joash Kamolo, not Omolo, Joash Kamolo.
I'm sorry
I
about
will,
that, Joash Amolo.
K, Kamolo. But thank
Kamolo.
you. A lot has been, Yeah, Kamolo.
Thank you so much. Sorry for that.
Now, a lot has indeed been said about persons living with disabilities, some of which directly touch on KRA. So I will limit myself to issues pertaining to KRA. Now, ladies and gentlemen, it remains for me to talk about the policies to cater for PWDs, but before I do that, some issues were raised which I would like to respond to. Number one, there is belief that a special interest group, which includes caregivers, should also benefit from tax relief. Sorry, we don't give tax relief. We only give tax exemption, particularly exemption from income tax. Now we give that certificate. Now we operate under a certain statute, which is order number 36 of 2010, which only talks of persons living with disabilities who may qualify for exemption, but it does not talk about the caregivers. That is why we have only been dealing with or limiting our tax exemption to persons living with disability. It is tax exemption, not tax relief. Somebody also talked about community service organizations, if I can get it right. Now, these ones do qualify for exemption, but they need to apply directly to the Commission of Domestic Taxes. If there is such organizations out there, they are advised to apply to the Commission of Domestic Taxes so that they may be considered for exemption. They qualify under paragraph 10 of Income Tax Act, Cap 470. Last but not least, there was Mr. Rockefeller from Homa Bay, who talked about renewals and how difficult it is to get renewal of income tax exemption. I wish to say this, that we operate within the act I told you earlier. That act talks of the validity period of any exemption certificate to be 5 years. So whichever exemption certificate you give, it is valid for 5 years, after which it expires. And once it expires, you must apply for renewal thereof. That is why they are renewed. Yes, we understand there are persons with permanent disability, but I think it is being addressed and under proposed amendments. He also said how difficult it is, you know, that there are several challenges associated with renewals or seeking renewals. That may be true to some extent, but as you would appreciate, ladies and gentlemen, exemption means giving away taxes, and there must therefore be thorough assessment and vetting of such applicants so that you weed out those who do not qualify. I wish to tell you that there are quite a number who do not qualify and therefore use irregular means to acquire the exemption certificate. That is why we must be thorough in our assessment and we must be hawk-eyed. Now back to my bit, that is policies to cater for persons with disabilities. Yes, the policies that we ascribe to as KRA are, let me say one, this is exemption from income tax. Now, if you're a member of the National Council for Persons with Disabilities, you are required to apply for exemption from income tax. And if you are recommended, we will give you an exemption certificate that states that any income that is less than 150,000 shillings per month is exempt from income tax. Any income that is less than 150,000 shillings per month is exempt from income tax. It talks of income. Income could be employment income, it could be business income, it could be rental income, it could be pensions, that is post-employment income. It could also be investment income, which comprises interest and and dividends. Now, if you earn any or all of this income up to 150,000 shillings, you are not supposed to pay income tax. You are exempted. And that works to 1.8 million shillings per annum for everybody. Now, the other bit could be relating to those who wish to import like assistive devices or motorized transport. But this one falls under a different department, which is Department of Customs and Border Control, who is in a better position to address that. So as far as we are concerned as PRA, we give exemption of income tax, and we also waive or exempt duty to those members of the National Council for Persons with Disabilities who want to import items. That is all I wish to say for the time being, unless there would be a question or two from the plenary. Thank you.
Thank you so much, Mr. Josh, for the knowledge you shared and the brevity of the same. I now welcome Ms. Susan from National Council for People Living with Disabilities.
Hello.
Hello.
Oh, okay, fine. Okay, so my name is Susan Wekesa. I'm from the National Council with Persons Living with Disabilities. So I had one question in regards to registration. As we all know, the council is mandated to register persons living with disabilities, but the registration process is a little bit long, in the sense we do the massive registrations for the persons, then the medical report and assessment report is taken to Ministry of Health, where all the documents that we have submitted have to be verified by the Directorate of Medical Services. So we are in talks with the Ministry of Health in how we can devolve the system in regards to the people from all the counties do not necessarily have to take all their to bring all their documents to Nairobi. If the Director of Medical Services can assign a person in each county who can actually do the certification and the verification of the documentation that we have submitted, then it would be easier for us to be able to register people as fast as they come. But now that is the challenge in regards to registration. But the council is doing some efforts in regards to on-spot registration. For example, if we can actually, you come to our offices, we visually see, or go to any of our branches in the county levels, and we see actually you have a permanent disability, you are registered there and then. You're not supposed to, we don't take you through the whole process of it's called what, filling up the medical form and doing all the other things, because as much as we are trying, as much as we are trying to do the registration for on the spot, it's for special circumstances in that regard. And in regards to persons living with disability knowing their rights under the Act and under the Constitution, we have actually tried in the level best to educate them as they come. We are going to roll out a pamphlet and also newsletters, and also do legal aid clinics in regional areas, and partnering with several partners. At the moment, we started with Nairobi, and then we are looking maybe to go to Kisumu, where we have gotten a bit of complaints, and then we go to Mombasa. So there are a few changes that are happening in the council, which we are trying to address in regards also to the aspect of tax exemption. Most of our clients come here to complain in regards to the renewal. So now we have to explain that that is not our mandate, that the renewal of the tax exemption is done by the KRA. So for most of them, they have stated that it's a frustrating effort, but we will still have to have discussions to see how we can easily ensure that all of them get, not even get, but all of them benefit from the tax exemptions. But for registration, we are trying on our best. We previously had a massive registration in Kisumu and in Kisii. So we are going to do another one maybe in the next quarter, so that we can be able to at least try and register people as fast as possible. And then we are going to also work with the Kenya Bureau of Statistics in regards to data, because we have noticed that the data that they portray and the data that we have is totally different with one another. So we will have a discussion on how to harmonize the information that they have and the information that we have. That's all from me.
Thank you so much, Susan. We have some questions on our Q&A. There is a question that was raised by Mr. Wilson Kioko. What's the process of acquiring tax exemption certificate? That will go to Mr. Joash. There is also a question by Mr. Wycliffe Osango asking Mr. Boniface, which tool is used to measure, I presume it's vulnerability of persons with disability to access funds from the National Council of Persons with Disabilities? This should be well elaborated and awareness on it done to avoid complaints from PWDs. I think that question cuts across for Mr. Boniface and Ms. Susan too. And then there's a question on mental health disability is not recognized by social protection because it's not physical. And we're asking for those living with dementia, which is severe disability and affects not one living with dementia, but the family. Those with dementia should be included in severe disability cash transfers. Mr. Joash talked about the amendments that are aimed in inclusion of the caregivers. I think you can answer that too. How does disability affect income tax? That's a question we'll direct to KRA if I'm not wrong. There is a question by Charles. Thanks, Joash, for your strategic presentation. In responding to bottlenecks quoted in reference to tax exemption, kindly explain the process, similar to the first question by Mr. Kioko, I presume. Susan, National Council for Persons with Disabilities or Persons Living with Disabilities, from Wycliffe Osango. Susan will answer that for us. Sandra is asking, hi Susan, thank you for explaining the disability registration process. Kindly clarify if the devolved process includes processing and distribution of disability cards at the county level. Also, do we have a set timeline for this to be fully realized? There is also a question from Florence. What efforts are the different agencies making to sensitize the employers or organizations so that they embrace disability? Should be highlighted. So I'll go back to Mr. Boniface and then Mr. Joash and then Susan in that order as we wind up. Thank you so much. Just at most 5 minutes to react to those questions. Mr. Boniface, are you still with us?
Sorry, Coach. But Boniface left for another meeting shortly.
Okay, thank you, Josh. Joshua, sorry. Let's go to Mr. Josh.
So, thank you. Let me talk about the process of acquiring income tax exemption. As you all know, disability is a medical phenomenon upon the Ministry of Health opinion. Now, step number one, anybody wants to apply for income tax exemption is allowed to do so. But the first step is to go for medical assessment in government level 4 hospitals and above. It must be level 4, it can be level 5 or level 6, but not anything less than level 4. Then once you get your report, it is called medical assessment, it is called assessment report, sorry. That assessment report goes to the headquarters of Ministry of Health, where it must be signed or attested by the now it is Director General of Medical Services. After it is signed, it becomes a medical report. Now, medical report is a critical requirement to an application for income tax exemption. We have a checklist which spells out the documents to be attached to an application for income tax exemption. These are the requirements. Number one, you want that medical report. Number two, you want a letter from employer or proof of income. Now, if you're not employed, you must have some sort of income, for example, rental income. If you are unemployed, you want to give rent schedule. If you're a pensioner, we want you to give us proof. If you're a businessman, we expect you to give us accounts or financial statements. If you're a farmer, similarly, we require you to prove to us that you are a farmer. Because it is exemption from income tax, you must have the income so that we exempt you. Now, once you have your documentation right, you submit that application to the National Council for Persons with Disabilities, which will go through that application. If it is in order, it will be considered as an application. Now, that application must be vetted. Where the disability is so obvious, say like total loss of sight, loss of upper limbs or lower limbs, you know, we don't need to see you. You would be recommended through desk vetting. If the council is not so sure about the extent of your disability, you will be invited for vetting. Now, there's a vetting committee which must assess you at this stage. This committee comprises KRA. It also comprises Minister of Health officials and also the National Council for Persons with Disability. Now, if this vetting committee recommends you, then your application will be scanned and uploaded to KRA iTax system because this process has been fully automated. The council is the only person with rights to scan and upload your application to KRA system. Now we will receive your application in scanned form. And when you approve it at KRA, you will receive it in your email address, and it is you to print that exemption certificate. If we reject it because of tax-related issues, similarly, you will find a message of rejection in your email address. So that is the process of acquiring income tax exemption certificate. It is fully automated. I believe I've answered your question. Thank you.
Thank you so much, Mr. Josh. There were some questions directed to Susan. Susan, can you kindly respond to those questions?
Okay, so it is actually persons with disabilities, not persons living with disabilities. That's one correction. And then the issue of cards. We do have disability services officers at the county level who sends a list of people who have applied for, who have registered with us to get the disability cards from us, the National Council card. So when they send it to us, the cards are printed and they are sent to the county, where the respectful owners are advised to go to their county, to our county offices to pick them. So long as they have submitted their names to our to our DSOs. So yes, actually the process has been devolved, but now we are relying mostly on our DSOs to send the list in Nairobi, because it can only be printed in Nairobi, so that we can be able to dispatch them after once we receive the list. I think there are only two, those ones, unless there's another one.
Thank you so much, Susan. We appreciate your time and your response to those questions, and we're really looking forward to engaging every stakeholder on board so that we can have lasting solutions, or we can just make progress on this part. So I'll welcome Mr. Wycliffe from KPO, who's standing in for Madam Elsie, to give the closing remarks so that we can bring our discussion to an end. Thank you. Mr. Wycliffe.
Thank you very much, Koech. These are. It has been a very great engagement, and I hope for us who have been able to log into this call, we've learned one or two things that we'll take to our respective organizations to enable persons with disabilities access services free of barriers. From the report, we've noted their challenges, and we all have an obligation to facilitate persons with disabilities to be able to access services on equal basis with other people. Now, as I close, I would really want to thank our panelists for taking time and to be with us. KRA, thank you so much for coming in, because this is a very crucial bit that we really needed you people to come in and give an explanation to why the gaps exist. We have had questions from different participants, and the questions, I know they will trickle down to different groups working in different in the regions, that is Kisumu and Nairobi. National Council of Persons with Disabilities, this was crucial for you and for us, because persons with disabilities are registered. It is assumed that most of them are registered by National Council of Persons with Disabilities. So by this report, by sharing of this report, I'm very sure that we've noted the areas that need improvement, and as you go back to the office, you will address this with the management. Kindly pass our regards to Mr. Harun, and pass our congratulations message to him. To general participants who took time to log in, thank you so much. We're looking forward for in future to have such engagement, so that we can bring the society that is left out, that is marginalized, and so that they can voice out their issues. Thank you so much, participants. Let's see each other in the next engagement. Thank you very much.
Thank you so much, Mr. Wycliffe. Madam Irene. From the National Taxpayers Association, we'd like to thank everyone. We're having a tweet chat to carry forward the conversation that we've had today at around from 2 p.m. to 4 p.m. because we believe there are some people who are not with us today. But through the tweet chats, we want to disseminate the information and maybe get the reaction from the members of the public. We are very grateful for your time, and we do wish you a wonderful evening, a wonderful afternoon. Thank you so much, and goodbye.
Thank you. Goodbye.
Okay, goodbye.
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 Bye. Goodbye.
naitwa Lavenda. Tembea anatembea tu kidogo. Kwa pesa ya ngapo inatumia kwa sababu mtoto wangu nimemrejea National Council na anajulikana na National Council ya kwamba mlemavu, lakini mimi hapa chini sijui ni wenye wanasimamia wajafika mashinani vizuri ama ni
zile simu tulikuwa nazo ni kama walibadilisha. Kwa hivyo hakuna mtu unashikana naye. Hata sasa hata usikii maneno ya nini. Lakini unasikia kuna watu wanapewa, lakini ukilisikia tunaambiwa unasikia wakisema hawajapewa. Lakini certificate walipeana mara mingi. Pesa ya mwisho ilikia 2016. Na sasa wakati wa Sebes. Lakini wakati wa Pasaris hajawahi peana. Hatujawahi sikia tena. Yeah.
Yes, hiyo pesa inaitwa affirmative fund. Ningependa serikali iweze kufikia yule mtoto ambaye ako na ulemavu na anategemea wazazi wake. Sana sana serikali iangalie hao watu, kwa sababu hao ndio watu wale ambao wanaumia zaidi. Utapata mzazi alikuwa kiangiva, alikuwa anajifanyia kazi, lakini wakati anapopata yule mtoto mlemavu anakatisha kazi yake, kwa sababu huyo mtoto hawezi akaandikiwa hata msichana, hawezi akajifanyia kitu. Kwa hivyo yule mzazi anaona sasa aje kazi, na yule mzazi sasa anakuwa hata ako na shida kuliko yule mlemavu, hata anaweza jifanyia kitu.
Huwezi jua ni sababu gani? Sababu kila budget ikisomwa iko pesa iko, lakini hujawahi kusema kusikia wa vikundi sikuje sikuchukue pesa ama tumewaandikia cheki. Kwa hivyo huwezi jua sababu gani pesa imekosa kufikia.
Na mimi nasema asanteni sana kusikiliza taarifa hii ya Sauti ya Kenya. Nilipokuambia msikilizaji kwamba utakuwa unasikiliza nini hapa, kile kipindi cha mawaidha, utakuwa unasikiliza saa 6 kamili. Nasema asanteni sana kwa kusikiliza Taifa Sauti ya
Mtoto mmoja walikuwa wanadai 15,000 na hiyo pesa mzee alikuwa anaweza pata. Sasa tukaletwa huku, sasa hii tuko na hao. Sasa hiyo ndio shida. Tutaweza pata tu children homes, hata wa serikali watusaidie kupeleke huko, wakae huko, ndio hata sisi tupate tu nafuu kidogo.
Serikali iachukue watu wenye wako na hiyo mzigo kama caregivers wenyewe, si waende kutafuta mtu mwenye ana ulemavu, ajui chochote kuhusu ulemavu, wanamweka kwa hiyo ofisi